everyone. My name is Maria Gracia Rivas Perrier. I also go by MG, and I'm a board certified music therapist. I work in the Center for Cancer and Blood Disorders here at Children's National. We currently have two music therapists, with Michael Pellegrino being our second one. Now, for those that are not familiar with music therapy is the evidence based practice and health profession where a credentialed professional uses music interventions to reach someone's individualized needs within that therapeutic relationship. So the goals really change depending on who we work with. Now, one of my favorite things about my job is that therapeutic relationship and the fact that every day is different. So a typical day is never the same. My sessions in clinic and on the inpatient side vary all of the time. So one session may be with a little baby and their caregiver, where we are working on developmental support through music experiences while also focusing on that special bond that the caregiver might have with their baby. Then I might walk into another room and have a session filled with singing songs from Frozen or Moana, during which a patient can fully release everything they are feeling and self express through that preferred music. And then that same day, I might have a session with a teenager that might look like creating beats and freestyling about their pain so that we can target that pain management. Now, something that not everyone might know is that music actually activates the whole brain and causes psychophysiological responses in the limbic system. And because pain is a multifaceted experience, music therapists can focus on pain management and someone's emotional well being in that same session. So, some fun facts to share is that in addition to that, music also affects a change in heart rate, respiratory rate, and blood pressure. So studies have shown that one single session of music therapy has shown to be effective in reducing heart rate, respiratory rate, anxiety, and pain. Now, most people have had an experience in which music has caused a physical or emotional effect. And as music therapists, we lean into this ability of music to assist all the patients and families that we work with. Now, the beauty of music therapy is that we can often communicate without speaking. Now, it's important to recognize that music is so incredibly powerful and impactful, but it can also be harmful when it's not used correctly. So, while a song might remind you of a loved one or can really help normalize the hospital environment, music can also be triggering. So, it's important to have a certified clinician to be there with you to help you navigate some of those emotions. Now, thank you so much for listening and watching this episode of Bear Bites. If you have follow up questions, I love questions and I love music therapy, so feel free to leave them in the comments. Thank you.